Welcome back to Morning Joe. Joining us now from New Orleans, House Majority Whip Republican Congressman Steve Scalise of Louisiana. Congressman, good morning. Good to have you with us.
Good morning. Good to be with you.
So let me ask you about yesterday's of the bill. You led the vote. You got them to 216, and we even one additional one at 217. I want to ask you about the state of Louisiana, though. Some 30% of people under 65 in your state, sir, have a pre-existing condition. What do you say to them this morning? They have a lot of fear, not just in Louisiana, but people across this country, that they may no longer be covered if this bill becomes law.
In our bill, we have multiple layers of protection for people with pre-existing condition. And I'll tell you what I'm hearing from my constituents, especially with pre-existing conditions. One, they're telling me they're paying a lot more than they were before Obamacare. But the other thing is the law doesn't work for them because in many cases, these are people who are utilizing the health care system more than most people. And so the deductibles, the massively high deductibles in Obamacare, in some cases over $10,000 a year, are really what's creaming them because they're going to the doctor and they're paying everything out of pocket, even though they've got a very expensive insurance plan. So they've got insurance that really doesn't work for them. They have to have it according to the law, and yet they're paying for everything out of pocket anyway. And they're saying, give me some relief from this. And that's what this bill does. It provides relief with multiple layers of protection for people with pre-existing conditions and a real focus on lowering premiums for all Americans.
But as you know, Congressman, under the Affordable Care Act, insurance companies could not deny coverage to somebody with a pre-existing condition. That remains true under your bill, but
that's in our bill.
But an insurance company under your bill could charge more, making it for people with pre-existing conditions, many of them unattainable, unaffordable. Do you worry about the people who will no longer be able to afford the coverage even though it is available to them?
Well, first of all, that's not true for anybody who already has insurance and keeps insurance. And even if you lose your job and let's say you go on COBRA or you go on Medicaid, you still are continuously covered. And in the bill, it ensures that anybody who's continuously covered gets priced like anybody, whether you have a condition or not. The other thing is if a state wants to have some kind of waiver to have more flexibility, in our bill, we actually give states flexibility to do an even better job instead of some one-size-fits-all Washington program. And so even if a state wants a waiver, they can't waive your continuous coverage provision, and you have that same protection, but they also have to put in place a high-risk pool to lower costs even more for people with pre-existing conditions.
So, Congressman, are you able to look into the camera this morning and say to everybody in your district and everybody in this country who currently enjoys coverage, who has a pre-existing condition, that they will continue to enjoy that coverage under your bill?
If you have a plan today and you have a pre-existing condition, under our bill you'll be protected forever as long as you want. You can move around from one plan to another. In Obamacare, you really don't have choices. As we saw in Iowa just 2 days ago, in 94 out of 99 counties, you won't have anybody that'll sell you insurance in Obamacare. That's how bad this law is. We need to change it. We need to give people real choices and lower premiums. And in our bill, we have multiple layers of protection for people with pre-existing conditions.
So everyone with a pre-existing condition right now who is covered under Obamacare will continue to have coverage?
Absolutely.
Everyone?
Oh.
Everyone.
And will their rates will remain affordable even though there's now more flexibility for insurance companies state by state?
Their rates will remain affordable. If somebody just drops out of the insurance market altogether and then wants to come back and get in, we put extra money in place. In fact, the last amendment that was added just a few days ago, and maybe a lot of people didn't get a chance to look at it. Our members did, because it was an 8-page amendment that put an extra $8 billion in the bill to help specifically people with pre-existing conditions who just chose on their own to stop having insurance coverage. So now they can even get back in the insurance market and actually get coverage that's affordable for them.
Sam Stein.
I want to talk about Medicaid. Medicaid, under your provision, there's $840 billion in cuts to the Medicaid. The CBO estimated that 14 million people will lose their coverage. Out of the 24 million people that lose coverage, 14 million will be Medicaid eligible. What is your message this morning to someone who depends on Medicaid? They're low-income people, often have bad medical conditions, can't afford private insurance, so they need federal help. What's your message to them as they watch this? I've talked to a bunch of them. They are petrified about their medical futures. Can you give them some relief?
Sure. What I would say to people on Medicaid that are concerned today is help is on the way. Anybody in America that's on Medicaid knows it's probably the most broken form of health care. In many cases, even if you're on Medicaid, it might be a free insurance card, but very few doctors take you. In fact, I don't know of many doctors that take new Medicaid patients. So you have an insurance card that's free, but you can't go see anybody, so you're seeing emergency room visits are going up. What we've been wanting to do for decades is to actually reform Medicaid so that states can run the program. Right now it's run out of Washington. If you have an innovative idea in a state, you can't even change the program to help low-income people.
Just to be clear, though, when you take you're taking $840 billion, so flexibility is helpful, but in sheer numbers of dollars, you're going to end up with 14 million fewer people without health insurance. What do you do for those people?
Well, first of all, if you look at that CBO score that you're citing, just look at the first year. CBO says 10 million people will lose health coverage in year one of our plan. And, of course, in year one of our plan, we have a transition where nothing changes. And so I actually went and asked, I said, how can you say people will lose coverage when the law stays in place? And they said, oh, well, because you give people the option to get out of Obamacare. So we think 10 million people will actually go choose something different. That's called freedom. Nobody lost anything. They just said Obamacare doesn't work for my family. Finally, under our Republican plan, you can actually get out of Obamacare and go buy something better for your family. You didn't lose anything. But ultimately, what we're focused on is making the program work better. Medicaid does not work well. We actually give governors and states the ability to run their program with flexibility with the same dollars they have.
Can I just jump in for a second? We've talked a lot about the bottom of the totem pole, the elderly people, as far as with pre-existing conditions and the poor. Let's talk about the top. Explain to me either the political, moral, or the economic logic of giving anywhere between a $400 and $800 billion tax break to people making over $200,000 a year. I'm not quite sure of any logic that gets me there.
Well, first of all, you've got to understand what Obamacare did. Obamacare put about $900 billion of new taxes on the books. That's just Obamacare. What we do is we cut all of those Obamacare taxes. So that means real money is going to go back in the pockets of everybody. No,
but that's just the rich. No, lower-income people are not getting tax benefits.
If you think somebody making $25,000 a year or $30,000 a year and paying taxes is rich, then maybe you need to go reevaluate your definition. Everybody who pays taxes will actually get a tax break because we cut the Obamacare taxes. All of them.
The disproportionate goes to the benefits do go to the wealthy people. That is a fact.
Well, if somebody pays taxes and we eliminate that tax, then that means everybody who's paying that tax gets their money back. It was a bad tax. Obamacare's taxes were focused on just going out and punishing anybody who's in the insurance marketplace. It's one of the reasons you saw insurance costs spike dramatically under Obamacare. And look, all these people that are defending Obamacare, that's their prerogative. But Obamacare, what are they saying to those millions of people who are paying 25% increases? In Maryland next year, they're expected to pay 50% more for their health care. In Iowa, in Virginia, you're seeing the largest provider pull out of the entire state of Virginia. And they're just going to sit on the sidelines and let that happen. The law doesn't work. So if we're getting rid of the things that are killing families in Obamacare, look, you criticize it, but those families have been waiting for relief for 7 years. We campaigned on this. We got elected on the promise of gutting Obamacare and replacing it with reforms that actually put you back in charge of your health care decisions and lower premiums.
Congressman, I know you've got to run, but the reaction in the upper chamber from the Senate yesterday after you passed this through the House was effectively a collective eye roll, including from many Republicans who said, that's great what they did in the House. We're going to start with a clean slate and create an entirely new bill. Do you believe all these things you've touted here today, all these provisions that you worked so hard to pass, will ever actually show up in a law?
Well, what I would say is if any senator's got a better idea, I wish them well. A lot of those senators literally have a bill with their name on it and nobody else. What they're going to find is you have to build consensus. We put 217 votes on the board, and it took weeks and weeks to do it because everybody's got good ideas. Some of them don't work for other people. The senators are going to need, if you've got a good idea, you're going to need to find 50 other people that share your good idea. And the focus needs to be on lowering premiums and putting families back in charge of their health care. That's what we did. We put a really good bill together that will achieve those goals. If they've got a better way to do it, I wish them well. I hope they can do it. But ultimately, their focus needs to be the same, and that is lowering premiums, rescuing families from the failures of Obamacare, and then we gave them that opportunity. Good luck to them.
House Majority Whip Steve Scalise, thank you very much for being on the show.